Another topic I'd like to talk about is circumcision, which gets to be kind of a touchy subject. Sometimes people are somewhat embarrassed to talk about it, but let me give you a urologist's opinion of this. So many people, especially in modern times here now, are choosing to not have their child circumcised, which is completely fine. I tell everybody you have to remember that most of the world is not circumcised because they don't have access to medical care. But in first world countries, many patients, children, are circumcised. And so patients will come to me and they'll ask me, well, what do you think? Should I get my child circumcised? And I guess I have 2 points on that. Number one is, as I just said, most of the world is not circumcised. But number two, as a urologist, you have to remember that I see all the problems, especially in older patients and grandfathers who are not circumcised. The benefits of circumcision are that it prevents long-term complications such as infections, lower incidence of sexually transmitted disease, and cleanliness and hygiene, and other problems that can happen associated with other medical diseases such as diabetes as you get older. But to choose to not have your child circumcised is a completely personal decision and very reasonable also, as that the large majority of all those patients who are not circumcised are going to have no problems going forward. In the early newborn phase of their life, in the first or second year, all patients will have a adherent foreskin, so you will not be able to reduce it if that patient is not circumcised at the first month or so of life. And the way I like to describe it is the turtleneck, the foreskin is a turtleneck and is essentially glued and stuck to the head of the penis. And what happens over the next few years is that skin makes oils and slough cells. It pushes that skin away from the head of the penis to where it becomes reduced. Most patients cannot reduce their foreskin in the first few months of life. At 5 years of age, greater than 90% of patients are able to reduce their foreskin. So it's a time process, and you don't have to manually reduce that to keep it clean or prevent any other problems. But once you get to be past that age, or you have some problems where there's scarring based on recurrent infections, diabetes that causes some vascular problems, the foreskin can become scarred down to where you cannot reduce it and pull it back over the head of the penis. And those patients usually need to have some type of a procedure, usually a circumcision, to fix that. The older patients who have significant medical illnesses, who have scarring of the head of the penis or scarring of the foreskin when it's not been circumcised, we can often do a procedure just in the office to make a small incision and reduce that and put just a few stitches in without a full anesthetic and a formal circumcision. So it comes back to, so should you get your child circumcised or not? It comes down to a personal preference. I think that in today's time, many patients choose not to do it, but there are some reasons to do it, such as cleanliness, function in the future, disease limitations as far as sexually transmitted disease, and presenting long-term complications in the older population.